I will say that Geico commercial with the camel, no, it's not hump day. It's wine Wednesday. That's what me and my girlfriends are always going for. Hey, Dr. Taweel, we're excited to have you on because I have a lot of things to ask you about because, but before we get there, wine is good for you, right?
Wine is good for you in moderation, always in moderation. And no, I don't mean you're like, okay, one glass a day. And then you say, well, I'm drinking for the next 8 days right now. You don't want to do that. Just a little, everything in moderation.
I will say when we would come back from France, because it was like wine was actually cheaper than soda.
Oh gosh,
it's crazy. Like you
could
buy a bottle of wine cheaper than.
I remember I went to Napa years ago, and you go to 7-Eleven, and they'd be like, "Welcome to 7-Eleven Estates," and they're trying to like get you to drink wine everywhere.
Well, I would love to do that, but our trip to Italy was canceled because of COVID. And so we haven't been able to make it back. But the lucky thing is my sister's place in France hasn't sold yet. So we're still going back there.
Well, I wish you the best. And if you need an extra physician to just kind of tag along, I would be happy to join you. That's all.
Hey, but we're kind of having you on the show because, as many people know, I'm leaving the show. But I was a cable commissioner. I'm a Kiko Harbor, so I'll fill in when they need me here and there. But I'm kind of starting my own thing. But before we even announce any of that, but every time we have you on, it's like. I'm like, how can you have them on again? You know why you can have them on again? Because the news changes every single day. I am still so confused. I know my husband's work announced today that they have to start wearing masks again, whether they're vaccinated or not. The Big Three has announced that he's covering the NFL. And even though he is vaccinated, he still has to do a test, a COVID test every week or two. And he's on the sidelines. And I'm like, no, I wash my mask and I put them away. I don't want to bring them out again. Is this just going to be our future for a while?
I think so. I do. I think that masks, I personally felt that masks were going to be something that people were just going to start doing a little bit more. You see that in other parts of the world where people wear masks. A lot of them do it for smog reasons, et cetera. But I think just given everything that's gone on, certain people are just definitely, they're leery and they don't want to go through this anymore. So I think they're trying their best to do what they can. And I think that's commendable and certainly their decision to do. But I do think masks are, as this continues, which is unfortunate. And unfortunately, again, the reason it continues is because here and in parts of the world, it's still able to spread. So until we can get a really good lid on this, I don't think we're going to go all the way back to, closing the world down like we did. And thank God we won't. But, I think there's going to always be some precautions that we're going to need to take. I think this is a I don't know the words I would use, but just a big wake up call for the nation, I guess.
But Dr. Taweel, if I can ask you, because so much focus has been on that 70% benchmark, and the U.S. made that. We reached that benchmark this week, even though it's late. So why is all of this happening? Is it because of the variant, the Delta variant?
I think that's a part of it. And I also think that 70% is among people who can be vaccinated. Now, I would double check my numbers on this, but 70% of those who are eligible for vaccination versus 70% of the population as a whole. So, and yes, the Delta variant certainly plays a huge role in this because we're finding out now that the Delta variant is still affecting people even if they've been vaccinated. Make no mistake, just because you've been vaccinated does not mean you are completely immune from catching COVID. The vaccines will really help to prevent you from dying of COVID. And that's kind of the goal we're after. So I want to make sure that I reiterate that the vaccine will save you. I don't want you to feel that I don't want people to feel that they can get the vaccine and then they're just invincible, which is why now the CDC has changed their guidelines, suggesting that in really high risk areas, certain parts of the country that are really, really going up there, even if you've been vaccinated, it's encouraged to wear a mask.
So if I can ask you, because we had the headline today that Michigan has the 5th highest child COVID cases in the country, but the kids can't be vaccinated.
No, not yet.
So what is a parent to do?
Parents to do the best that they can to prevent the kids from getting COVID through means that are unfortunately not, unfortunately they're not able to get vaccinated, but fortunately they're able to do other things, social distancing, hand washing, the same stuff I've been saying since day one, wearing a mask. I don't necessarily know if they're going to close down, schools to that degree, but I have a feeling that we're going to start to have those scenarios where, we're going to get positive cases in schools and they're going to be suspending classes for periods of time. And, it's going to be a bit of a mess, but I think that we just continue to make sure the parents are vaccinated so it's not catching, so kids aren't bringing it home to their families and causing bigger issues. And eventually, once the FDA gets the approval and the studies show that it's going to be safer for kids, I think they'll be able to do that, and God willing.
And I was like, can we kind of piggyback on that? Because we do know that Pfizer looks like it's probably just weeks from getting the FDA approval. How do you think that's going to change when it comes to some of these mandates?
I think it will be, as the person that was previously interviewed said, I think that will allow people to be a little bit more, better suited to mandate things. And I know that if it becomes FDA approved, then I know private offices such as mine will be able to get the vaccine so that I can give it to patients. So I think distribution will be definitely a lot easier for people. I also feel that it will also be, again, for issues with mandating, military, et cetera, I think it's going to be a little bit better. And I think it will also help kind of quell a lot of the ambivalence that people have towards the vaccines, because I know people are still concerned. People are always going to be concerned. They're worried. What are the long-term effects of the vaccine? Well, we may not know them completely. We've done studies to give us a good idea, but also let's not forget we don't know the long-term effects of COVID. I still have patients that have had COVID well over 6 to 8 months ago, still dealing with a lot of those problems. And so I think that in the long term, I think we just need to take the option that's going to be a little bit better for not only the patient, but also for all of the patients. So
I will say, I've had friends that have had COVID and 6-8 months later, they still can't smell food. And I'm like, why can't that happen to me? Maybe I won't want to eat so much.
Yeah,
is that wrong? I'm sorry, but I know every chick is thinking that.
It could be a good thing though, because some people just really don't like being in those masks, like sneezing in those masks. It's a whole experience. Oh my gosh. But also, I have a lot of patients that's, the understanding is that this loss of sense of smell and taste could last for about 6 to 8 months. And I got people beyond that are still having those issues. So we're, again, still finding things out, which is unfortunate, but we're doing the best we can.
Dr. Jamie Taweel with us here on the MegaCast, internal medicine specialist for the Grand River Medical Associates. And Doctor, can I ask you, when we're talking about the vaccine, because I had the J&J, and I had the J&J because it was a one shot. I specifically went for the J&J because of that. I don't like needles. I'm a wuss. I admit. But now they're saying maybe people who had the J&J should get a second shot of the Pfizer or the Moderna. What are your thoughts on that?
Well, I'm not quite sure because I don't have a lot of studies that I'm looking at that are going to tell me one way or the other. And everything I do is based on studies that I'm able to read and tell people. Evidence-based medicine. I'm not just guessing at these things, and most of the physicians aren't. So I think that it would. If I had to go based on feeling, I felt that something like that was going to happen. I have a feeling that there's going to be boosters for all vaccines. Unfortunately, I know the J&J was an excellent option because A, it didn't have to be refrigerated. B, it was one dose. Now, if you look at that, I got the Pfizer vaccine. I had to get the first dose. I had to wait 2 more weeks, get the second, or 3 weeks, sorry, get the second dose, and then wait another couple more weeks for that immunity to kick in. And that was a long time, and no one wanted to wait that long, specifically in the middle of this nightmare that we were dealing with. So I don't think it's I didn't think it was a unwise decision to go for the J&J. And yeah, one less shot in the arm, one less week of being sore is definitely an option to take. The side effects of J&J have been reported, but it looks like we might find that there's less of an immunity, and hopefully, if that's the case, we can just do a quick booster to get people where they need to be.
So, but with the booster, will the booster be from J&J, or is it going to be a booster from Pfizer or Moderna? And we just don't know.
I imagine it's going to be from J&J. And the reason I suggest that is because I don't think a corporation, you got to start looking at the business aspect of this.
Yes.
If there are side effects or if there are problems, now you're mixing two different companies and now you don't know where the problem lies. And I think that really confounds things a little bit. I did have one patient who she got the Pfizer shot and then went in for her boost, or, went in for the second shot and got a Moderna second shot. I don't know how that even happened, but that unfortunately did, and that should not have. But I do think that once if a booster is required, it'll likely be from J&J, just to be able to minimize, confusion with regards to any effects.
So while we're talking about vaccines, it just seems so crazy because it seems like the entire world has forgotten about all the vaccines that we have gotten from the previous years. So much focuses on COVID-19, but we are going into a new school year. Are you seeing that some of the kids or their families don't want to get them vaccinated, or are they behind on the vaccinations, or do they want to get vaccinated in the other areas other than COVID-19?
Well, I do internal medicine, and that's typically 18 and above. So I don't see a lot of kids, but I do talk to a lot of parents. I know that, and I deal with elderly essentially. And a lot of those people really wanted to be able to get all of their vaccines. I'll tell you this, flu vaccines went off the charts this year.
Really?
Everybody wanted a flu vaccine. So I ran out relatively quick. We had to keep reordering and keep them coming. And I think that's going to be the case for next year as well, because the flu vaccine, everybody knows. And I think if you're going to be able to try and reduce any risk whatsoever, I don't feel like it's going to be a huge issue. I think all of that, I don't know what word to use. I apologize, I'm nervous. But I think all of that hesitancy that people have will ultimately be, and ultimately is towards the COVID vaccine. And that's simply just because of the way it was distributed and rolled out. I mean, it all happened so fast. We were basically waiting at the door for the guy to come out of the door with the vaccine, and then we grabbed it and ran. And that really didn't sit well with a lot of people. And I have a few patients that are very anxious that they're even starting to mandate that. I know healthcare systems, certain ones are starting to mandate vaccinations with their employees. And I have a few patients that are employees that are not feeling good about this. So, it's understandable.
Say though, what's surprising to me is the people that work in healthcare, especially the ones that have been on the front lines of COVID-19, that don't want to get the vaccine.
That shocks me as well. I wish I could give you a good answer for that, but vaccines are unfortunately getting a bad rap. And I think if they just looked at the studies and were able to just get a little bit, my job is not to give orders, it's to make recommendations. So when patients come to me and ask my opinion, I'm doing just what I'm doing right now. I'm telling you that I feel it's a good idea based on the studies I've read. I feel the side effect profile is low. I feel the long-term effects are negligible, if at all, and we still don't know about them. And I feel that it is definitely the better option, whether or not it's get COVID or get a vaccine. I will choose the vaccine every time. Now, am I going to demand that and belittle you and punish you if you don't want to do that? No, it's a personal decision. You are entitled to make those. I do feel that certain employees, however, are going to have the right to say, look, if you're going to work here, we need to mitigate risk, and this is how we're going to do it. And if you don't like it, that's understandable. It's your decision, but I can't have you working here. I think that's going to happen. And I think that's, their right as businesses, free market. But the rise of healthcare employees and frontline workers who were very, very against the vaccine still is a mystery to me. And, again, it's their decision, and I don't fault them for it. They're able to do what they want. I just hope that, I'm sorry.
Go ahead.
I just hope that people just take the time to really read and educate themselves and not go on hearsay. You're always going to hear something about something. I read this or I heard that. I have patients all day long that I heard that it does this. And it's like, well, I've heard that too, but it doesn't necessarily mean it's true. I want you to be able to just read reputable studies and reputable sources that have actual data and numbers that are verified, as opposed to just these random things that are coming out, so that's all. I apologize. I didn't mean to cut you off.
No, there are some crazy things though when you go on social media. And I will say I have people close to me that are on both sides of the aisle that refuse to get vaccinated, and others that were like lining up first of the day. So you're trying to navigate this world, and not only like from you as a physician, but for us as a community and as family members and this, that, and the other. It's crazy. But how do you think this is going to impact the vaccinations for kids, the regular vaccinations going into the new school year?
Well, I feel that there's always been a rise in the last, 10, 20 years. There's been a slow rise in hesitancy for vaccinations for their kids. I've said this before that I feel that it might be due to the preservatives, because if you look at a lot of those people that had a lot of hesitancy to vaccines, a lot of it was due to like the additives and the preservatives, not the vaccine itself, but just how it was processed and produced. So I think that will always be there. I don't think there's going to be an increase in hesitance. I personally don't feel that there'll be an increase in hesitancy for the newer, for vaccines as parents are trying to get their kids vaccinated. I feel that the number of hesitancy rates will stay the same, but that's just an opinion based on my thoughts. I think the COVID vaccine, once we start to realize, is actually really helping and saving lives, and people are doing better when they get the vaccine. I think that will be proof positive that that's all that people need. And hopefully that will be the case.
Okay, I'm shallow. The reason why I got it is, number one, I kind of felt like you were pressured into getting it, but I was tired of wearing a mask because it messed up my makeup. My lipstick was always, smudged when it came up. I'm a chick. But I will say, Dr. Taweel, we always appreciate having you on with us. And I will, we have like 30 seconds left. I'm doing CBD freeze on my back. My back sees up. I'm getting old. I can't move anymore. It is horrible. I'm doing that with muscle relaxers and Motrin.
Oh, good Lord. And physical therapy. Here, I want to just kind of give you a quick little thing on that. A lot of people think that, I always say, never trust a physician that tells you they cannot do anything for you, and never trust a physician that tells you they can do everything for you. Those are the two big cautions. I feel that what I do, which is medicines, is a small spoke and a rather big wheel. So if you have issues with your back, I think that chiropractic medicine is definitely warranted in certain situations. I feel that physical therapy is definitely warranted in certain situations. Mind, body, spirit, losing weight, getting a healthier lifestyle, in addition to medications, in addition to, I don't want, there's no hard and fast rule that says you have to do one thing. And although I don't have a lot of data on CBD, I do have a lot of anecdotal evidence from patients that use it, and they swear by it. So I think if it works for them, I don't care if you have to do a rain dance in order to feel better. I just want results. I don't care how we get there.
I like the way you think. And thank you for always taking time to be with us here on the MegaCast. We so appreciate it.
Thank you so much for having me on. It's always a pleasure, and I'm going to miss you. So, and I'm always available. So if you ever need anything, feel free to reach out.